Well, good afternoon, everyone, and welcome to a very special Wellbeing edition to SHM's Practice Management webinar series. Thank you so much for taking the time to join us. Today, we are excited to share with you all a new resource the Wellbeing Taskforce has produced to help hospitalists connect with each other and collectively process their experiences during the pandemic. Before we begin, I just have a few technical things to cover. In a first for the Practice Management webinar series, we will be having an open mic Q&A at the end of the presentation. For best audio quality, we recommend calling into the webinar using your phone and then linking it directly to your computer. Instructions for which are on this following slide. Your microphones will be muted at the beginning of the webinar, so we are directing you to use the chat feature to communicate with us if you are experiencing any technical difficulties. If you don't feel comfortable asking questions live, you can still, of course, submit them via your control panel, and I will field them to our presenters. We are recording the first part of this webinar and will be publishing it on SHM's online learning portal and YouTube channel. The Q&A portion of the webinar will not be recorded. This webinar and other COVID resources have been made freely accessible to the public during the pandemic, and they're only possible through member dollars. So if you find today's webinar valuable, we kindly ask that you consider joining SHM to ensure continual access to the content you need most. I'm joined today by two members of the Wellbeing Task Force who were instrumental in the production of our Checkin guide. Sarah Richards from Nebraska Medicine, who is also the chair of the Wellbeing Task Force, and Patrick Neelan from Dispatch Health. Sarah and Patrick, would you like to introduce yourselves?
Yeah, hello everyone. It's nice to be with all of you today. I so wish I could see your faces and that we were in a room together, but I'm glad you took some time to join us. I am a hospitalist. I'm in my 10th year at Nebraska Medicine, which is affiliated with the University of Nebraska Medical Center in Omaha, Nebraska, where we are currently surging right now related to the pandemic. I also have a role as our Senior Medical Director for Care Experience with oversight for both patient and provider experience at Nebraska Medicine. Patrick?
Yeah, hi everybody, Patrick Neeland. I am also a hospitalist clinically, and currently I'm Vice President of Medical Affairs at Dispatch Health, a late round startup based in Denver, Colorado, and lead our hospital at home efforts with Dispatch. Prior to that, I was at University of Colorado as a hospitalist and led the UC Health System with regard to patient and provider experience. So it's great to be part of the conversation.
Awesome. It is so great to have you both. So today we're just going to start with a brief discussion on some newly published data about how COVID has impacted hospitalists' psychological well-being. We're also going to talk about the Wellbeing Task Force and what we've done in our approach to COVID so far. And then we'll finish up with a brief training on the guide and how to use it to start honest and open conversations within your group and build mutual support. So without further ado, I will now turn things over to the experts. Sarah and Patrick, the floor is yours.
Thank you. Thank you so much. And I should have mentioned, we so wish we could see Patrick's face today, but technical difficulties got in the way with that. But what I wanted to kind of first do is talk about current state. I know that we all have our own experiences at our own organizations. I know different hospitals and parts of the country are being impacted differently at different times. And we are all individuals who experience the pandemic in a different way. What I think has been helpful is to really help normalize how truly difficult it is right now to be a practicing hospitalist. And to do so, I wanted to share some data that's been published recently that kind of brings some of that to light. So the Physicians Foundation published a survey in late August, and here are some of the key findings. So we know that about half of physicians have experienced inappropriate anger, tearfulness, or anxiety as a result of the effect on their practice or employment. Over half have feelings of burnout, and this is compared to prior data where just 40% have experienced burnout. 18% have increased use of medications, alcohol, or illicit drugs, and 18% have sought mental health care. I think the most sobering statistics on this slide are related to these last two bullet points, where 22% report that they know a physician who has committed suicide, and 8% of physicians have considered self-harm as a result of the impact of the pandemic. That was a general survey looking at a large physician group. This is more specific information to hospitalists. And so this was published in Hospital Practice, and it was a survey of hospitalists at the 4 Mayo Clinic sites, so representing 4 different geographic areas. They had 154 respondents, the slight majority being physicians. The majority reported concerns about contracting COVID-19 at work. The global well-being score of a physician or a hospitalist saying, you know, my global well-being is very good or excellent was 90% prior to the pandemic. And during the pandemic, that number has gone down to 53%. I should have mentioned that this was a survey that was done at 2 different times. As soon as there was an inkling that the pandemic was coming, they quick surveyed hospitals before it had any significant impact, and then were able to do that follow-up. And then social activities and relationships, you can see, went from 88% saying good or excellent prior to only a quarter during the pandemic. A little more detail specific to anxiety. Prior to the pandemic, the majority of us were actually scoring quite low in terms of 8 measures of anxiety. And no hospitalists were feeling overwhelmed, having trouble calming down, or having sudden feelings of panic. That being said, that during the pandemic, anxiety scores were high, with a quarter or 1 in 4 of us reporting usually or always feeling tense. In terms of social isolation, again, doing quite well socially as a bunch of hospitalists across the country. And then prior to the pandemic, nobody really reporting they feeling left out or isolated or like a stranger to those around them. And then again, over a quarter saying they are now feeling isolated from others. So I also read this article just a couple of days, and would encourage you all to spend what I think they said is 13 minutes to read this article. So it's not a short article, but this was one of those things that really helped me to feel less alone as a practicing hospitalist during the pandemic. The gist of the article is about our surge capacity and why we are always feeling awful. And so, Luke, if you can go back just a slide before I get into that, I just wanted to share that the idea of your surge capacity, so there's been so much literature looking at how physicians and other first responders and military do after a traumatic event. But these traumatic events are often short-lived. Think of something like a plane crash or a hurricane that is devastating. Or a battle or something of that nature. And so we are, as humans, able in some cases to really rise up to the occasion, all hands on deck, we have energy, we do what we can to support one another and to get through that traumatic event. And then we start the healing process and the recovery process. And the pandemic is so different in that it is going on and on and on and on. And this idea that we can only be ready and willing and able to be 100% or more at work and in our home lives for so long. And at this point, I'm hearing from a lot of my colleagues, both in healthcare and friends and family outside of healthcare, it's just, I just feel like I can't do this anymore. And that's kind of how they're feeling. I did pull some select quotes out of this article. I think it really brings to light just how things are impacting us more generally speaking. So what I thought was really profound is this idea that most of us have heard at some point in our life to, you know, we can expect more from ourselves. We're more resilient than we think. We're stronger than we think. But right now, our experts are telling us that we must give ourselves permission to do the opposite. It's okay to expect a little less from yourself and to spend a little bit more time replenishing. This is a time to maybe learn more about yourself and where do you get your energy? What type of downtime do you need? And to not feel guilty when you do those things for yourself. Also, you know, we know that there's so many things we can do in the realm of self-care to help ourselves. But one of the biggest protective factors that researchers are finding is that our social support and remaining connected to people is more important maybe than anything right now. And that would even include helping others when we're feeling depleted ourselves. It's a win-win strategy because we are all feeling helpless and out of control. But when you can take action to help somebody else, you are in control of that. And I know that this topic is and this idea is near and dear to Patrick's heart because he frequently talks about this. So I wanted to give you the opportunity to kind of chime in and add any commentary here.
Yeah, thanks, Sarah. And it's so important, this concept of surge capacity and this kind of continuous drain on us and our humanity as we walk through this incredibly challenging time. And I think for everyone, then what comes up is, well, how do we replenish that capacity in this concept of energy, and how do we reclaim some of that energy? And it, not surprisingly, these human connections. This is research from Barb Friedrichsen and Brian Sexton in North Carolina around the impact of human connection and experiencing positive emotion, finding positive emotion where we can, and the impact of positive emotion, even in trying times of functioning as sort of tiny engines of replenishment. So those emotions you can think about are things like hope and gratitude and awe and interest, and even love, which is a word we don't often talk about, at least in the hospital that I work at a lot. It doesn't come up much amongst colleagues, but it probably should. And so this whole concept of how do we find and access those emotions in our day-to-day interactions, those micro interactions with our colleagues. So thank you for bringing this up.
You bet. And Patrick, so thank you so much for sharing that. I personally just did a 7-day stretch in our COVID unit. And I'm typically on a teaching service working with students or residents or APPs. And in this last week, I was alone caring for patients, obviously very complex medical patients. And I did feel overwhelmed, and I did feel afraid, and I did feel tired. And I heard and saw some really sad things, and I really felt for my patients and what they were going through. At the same time, needing to be on point with all of the complexities of their medical care, and continue to be a wife and a mother of 3 daughters and everything else, just like all of you, have similar stories. But one thing that really stuck out to me about that past week was this idea of love and appreciation. And so it was the smallest thing in the middle of a really long and hard, trying day that meant the world to me. A stranger who happened to be on the bone marrow transplant team, one of their PAs, was communicating to me some recommendations regarding adjustments and medications for one of our post-bone marrow transplant patients with COVID. And she wrote this long message to me, and at the very end, she put a space, and then she goes, "And I just wanted you to know how much you're appreciated." And it was so simple. It probably took her a second to write. We don't know each other. I don't even know what her face looks like. But that, for me, in that moment, was a gift of love and support from somebody I don't even know. And so it's things like that I had enough of those little things to build me up and help me get through that week. And also, it was so inspiring to say, you know what, I'm just going to do this for everybody else because it's not hard. And even though I'm depleted, if I do this for somebody else, it's going to build me up. And so that what you said is true and something I definitely experienced.
Yeah, and I would just add, I think oftentimes when we're looking at a major, state of burnout and those kinds of things, it can be tempting to think, well, the only way to solve this is to have full day retreats, or I need to meditate for an hour in the morning. That's what everyone's telling me, and that's going to be impossible to actually fit in. And what else those pressures are, and thinking that we need some major intervention around some of this. And I love the example you just gave in terms of those micro interactions in the work, not some 4 hours that we have to carve out instead of being with our families after work or whatnot, but doing it in the work, finding those connection points. And the other thing I'll add, because you brought it up at the end, is the science on this is really clear that when we receive these things, these appreciations, there's an impact on us. And when you look at functional MRI and have people do things like express appreciation or gratitude for others, the effect is almost double. And in terms of what lights up when you're the one giving that, so that we all our capacity surged out. We're on fumes in many of these instances, and interestingly, paradoxically, our willingness to in those micro interactions say, hey, just wanted to let you know that was really impressive how you interacted with that patient, or I just want you to know how much I appreciate your effort as a part of this team, or whatever those things are. Refuel the other person, but also refuel ourselves.
Yeah, absolutely. I could not agree more. All right.
Wonderful. Thank you so much. And I just think you're both so right about it. Really is the little things, especially in a time when we can't make maybe wholesale changes, but just those moments where you are appreciated and someone takes that 5 seconds to say that can really change and brighten someone's day and have that ripple effect. So this is a really great lead-in to talk a little bit about the work of the Wellbeing Task Force and just our approach to supporting hospitalists during COVID. So I was wondering if you, Patrick and Sarah, could share a little bit more about the charge we've been given by SHM's board and how you two, as leaders in the task force, processed that and helped lead the hospitalists on this team into producing this check-in guide.
Sure. Well, our specific charge is right there on the screen. So that the board said this is what we'd like you to do. And I think the important words in this charge are immediate and COVID. So we all know and are well aware that there has been burnout described in the literature and experienced probably by everybody on this call related to being a hospitalist in normal times. We have obviously, as our prior committees really focused in on the systemic and structural components of burnout, which we'll kind of touch on and show you here in a second. But we are very mindful. We definitely recognize that burnout, or whatever word you might choose, is not new because of the pandemic. It has existed for a long time. And now this is just bringing it to an entirely new level and adding layers upon layers of additional stress for hospitalists. And so our charge really was to focus on specifically the impact of COVID and the immediate needs. And obviously we don't lose sight of some of those underlying structural and systemic issues, which oftentimes are part of the reason why COVID has made things even more difficult. Patrick, do you want to chime in here on your thoughts?
Yeah, and I mean, obviously the COVID pandemic raises new and unprecedented challenges for most of us. Most of us have never lived through something like this. In terms of the added stress and the ways that it can deplete our capacity for walking through jobs that are already, I would say, emotionally trying and logistically difficult often. But I'm with Sarah on that the approach to managing this or thinking through this is to think about what is it that we have immediate control over. And in that way, it's much, in my mind, very similar to pre-COVID in terms of thinking what can I control, or what can our hospitalist group control. And that's not to say that we don't need to advocate for some overhauls of the system at times, or to demand that we have the PPE that we need to do our jobs. But at the same time, how can we scale this to things that are I control, that I can replicate on a daily basis, that I can do inside of the work and not just as a layer on top of the work. And so that's a lot of how Sarah, as she's leading this group, kind of framed our task is what can we do that's very tangible, bite-sized, and has a really high return on investment in terms of the impact.
Yeah, I couldn't have said it better. Thanks, Patrick.
So moving on to the next slide here, we just wanted to give you a brief update and background that while the task force is specifically focusing on those immediate needs, the structural needs have not been forgotten. And we as a task force had identified that there are certain barriers between people accessing the formal resources perhaps that they would need. So way back in August, we identified this as a potential sticking point, in particularly the fact that as of this writing, 32 states still require mandatory disclosures on licensing forms for whether or not hospitalists have received mental health treatment. And we identified this as a potential barrier. And so at the request of the task force, our public policy committee authored a letter to the Federation of State Medical Boards urging them to put pressure on their own members in coordinating local advocacy efforts to maybe not do away entirely with these questions, but rework them to be more open and remove some of that stigma perhaps that would prevent people from accessing the things that they need and the help that they need. This letter is available along with other resources on SHM's website, and I'm sharing that link with you now all via the chat. So please feel free to peruse our selection and know that as the task force continues to think about these issues, these resources are going to continue to expand. So be mindful of that as well. Teresa, you can head to the next slide here. So as Sarah briefly mentioned, the task force last year was actually a subcommittee underneath practice management. And for the entire year, they spent time thinking critically about what are the unique characteristics of hospital medicine that lead to burnout structurally within practitioners. So the committee spent literally 8 months processing, holding informal focus groups, and we've pulled out 7 overarching drivers that we believe are at play in this issue. All of these are available on our website and come with a list of discussion questions to help hospitalists start these conversations within their groups and with their leaders. So we encourage you that if this is something of interest to you, to please check that out and to use them as resources. And here is just an example of one of the drivers that we've titled Scope Creep. And you can see in the top blue box that those are the discussion questions, along with some sub-points about how this driver is actively at play within hospital medicine. So now I'm going to turn it back over to Sarah and Patrick. I just want to say that we here at SHM are super excited about this resource and really feel that it touches on all the points that our panelists have shared so far. So Sarah, I'm going to turn this over to you and let you lead us through a little bit of a training about how to use this guide.
Okay. Well, thanks, Luke. You know, there are very few committees that I get excited for the calls, and this is one of them. This is such a dynamic group of individuals that are so passionate about well-being and about hospitalists and are so intelligent and expert in their respective fields. And what I love so much about this committee is that they have heart. And what came out of some really rich discussions around well-being and the pandemic and how it's impacting hospitals was really around how can we take a moment to check in and ensure that we first are doing okay, because we know that we need to be well to care for our patients, our colleagues, our families, our friends. And then also we know, as we referenced earlier, that when we help others, that is gratifying for us and so important for us to do so. And so our idea being is that this could have a ripple effect potentially, and that if each of you on the call were to use the check-in guide, which you don't need to have the guide in front of you to use it, you'll see how it works. It's quite simple. But if we could start a ripple effect across hospitalists across this country, we think it's a way to really help normalize that things aren't great right now, to help have more human connection and conversation around things that are difficult, so that we feel less alone, and that we recognize that it's okay to not be okay, so that when we can start to heal and help and support one another. So here is our guide. So it is divided up into 3 steps, and there is a QR code. So if you want to hold your camera, I'd encourage you all to do that if you've got your iPhone handy. If you're using your iPhone now, I don't think you can do it, but you can hold your camera up to the QR code and it will take you to this. You can also go to your computer. I think we'll have a link as well. It's on our website. The idea being this could be posted in workrooms or something that you could have to review, but we're going to spend some time kind of moving through kind of this 3-step approach to helping check in and help ourselves and our peers. So the first step is to identify. So these are the 3 I's. And this is a self-assessment. So we know, I love the oxygen mask analogy. We need to put our oxygen mask on now, yesterday, months ago. We need to be taking care of ourselves first and foremost. There's nobody more important in the world than you, because without you, you can't help all those hundreds of thousands of patients that you'll help in your lifetime. So the first thing to do is to check in and see how you're doing. And these are divided into several components. So from a physical component, these are just an example. Obviously, the lists are much longer. But are you having difficulty sleeping? Are you feeling tired? Do you have kind of a chronic dull headache or just kind of a stomach ache, upset stomach? Are you feeling more irritable? Are you snapping at your spouse or have less patience with your children or potentially colleagues? Are you feeling anxious? Are you guilty? This is one of those themes that has come up so frequently that I didn't anticipate, but it is something I'm really commonly hearing from a lot of my colleagues who are not hospitalists, who want to be able to do more, and they can't. They say, I just wish that I could be there taking care of COVID patients with you. Or you have hospitalists who feel guilty because it's not as bad at their hospital as maybe it is at another hospital or in another part of the country. Or you might feel guilt because you work for a health care system, but you are working from home right now and knowing that everybody else is going into work and being potentially afraid of contracting COVID. And so this extreme feeling of guilt, I will tell you, I even hear hospitalists that are working 7 on, 7 off in the COVID unit still feeling guilty because they have social support, or they don't have kids who are being homeschooled, or there's always this feeling of it's not as bad for me as everybody else. Or just simply feeling sad to see so much death and dying and turmoil that's going on. If you have difficulty concentrating, are you forgetting things? I've had several days where I cannot remember where I parked my car. Racing thoughts, this is another one, just me being vulnerable with all of you. This is now happening to me usually about 3 a.m. every morning, waking up and just having thoughts cycle rapidly through my head and not being able to do much for it. Yeah, Headspace does help, by the way, for me, not for everybody. But I've really struggled with racing thoughts that I just can't shut off. Or feeling more impulsive, maybe withdrawing, not really even wanting to have a Zoom call with a friend, or, you know, not really wanting to interact even virtually with people, or isolating, or starting to avoid responsibility. So all of these things are normal human reactions to stress. And so that does not mean anything is wrong with you. It just means you're a human being in a pandemic and you're experiencing these things. The problem is that when they happen day after day or start to impact your ability to function, and you just can't knock them. So again, these are super normal. If you're having these, you're not alone. Patrick, do you want to comment at all on that slide?
Yeah, yeah, and I think that's exactly it, Sarah. This is not about noticing these things and then you know, beating yourself up over the fact that you're going through this or dwelling on it per se. This is the point here is to check in with yourself, to be mindful of what is it that I'm experiencing, in what ways am I responding as a normal human to this very real insult of circumstance right now, and to just know that there's people all over the country that are experiencing these same things. Normalizing for yourself, I like to call it giving yourself grace, that you are responding as a normal human being, and then setting it aside. So I have a colleague who talks about, you know, that it can be important to notice these things, consciously let them go, put them to the side, and return to whatever it is you were doing previously. So noticing, letting go, and returning, I've found to be a helpful sort of loop for these in my own work.
Yeah, absolutely. And I will tell you that one example that I'll never forget is when I was talking to one of our critical care doctors who had just done 10 shifts in a row in the COVID unit and was exhausted. And we were talking through some of these things, and she goes, I can't tell you how relieved I feel to know that I can blame my irritability on the pandemic, on the stupid virus. I can blame how irritable I've been with my family and my kids on this. And that is a relieving thing to me because I just didn't recognize myself anymore. So, all right. So moving forward, we don't just do that, we do more. So it is so important. I think we've said it probably 50 times to connect with people, one-on-one or in small informal groups. I know everyone probably on this call is guilty of those brief hallway conversations, or maybe you're out in your yard talking to a neighbor. How's it going? Fine. How's it going? Fine. How are you doing? All right. You know, that's a pleasantry, but it's not maybe meaningful. It maybe doesn't get to the heart of a conversation that could potentially be really therapeutic for you and the other person. And so some open-ended questions that might be really helpful and that are included on our guide has just been saying up front, what's been the most difficult thing for you lately? I know I asked this question a lot before the election, and honestly, that was it. It was political divisiveness and uncertainty and lack of trust in science and institutions and all of these different things, but it almost seems to change week to week at this point about what people respond to with this question. Or how have things been for you? Tell me about your past few weeks. What has it been like for you? Or you seem to be handling the situation well. Is my perception accurate? I think this often happens with our leaders, people that kind of always seemingly have it all together and seem poised. I can tell you that oftentimes, based on conversations I've had with some of our senior leaders, that this is not true at all, and that they're putting on a facade, and that they're probably the people who are asked the least how they're really doing. But asking, gosh, you seem to be doing really well. Am I right? And maybe they really are, and maybe there's something you can learn about what they're doing to kind of get through things. Another thing that I find really helpful around in our team rooms from time to time to just kind of check in and see how everyone's doing. And if people aren't real chatty and we have a little bit of downtime, I just say, you know, what's been really hard for me lately is this. And then I start to normalize things that are difficult. One thing that was really difficult for me, both in and outside the COVID unit, is knowing that our patients don't have visitors, and how hard it is to know how lonely and isolated they are, and communication failures that occur naturally when you don't have as many family members at the bedside. And that opened a can of worms, and the whole team that I was talking to really wanted to share their experiences and how hard that had been for them. So it's just an example of normalizing sharing difficult encounters kind of opens things up. This can be something that you just consider dedicating time to doing, one-on-one, during a team meeting, just in a break room or team room. It might seem like, hey, this isn't really me, I don't really do this. I would just encourage you to just try it once. You might be surprised how it goes, and how potentially therapeutic it is for everybody. Patrick, what would you like to add here?
Yeah, I think it's awesome. And what I love about that second one is I mean, what we're really doing when we do that is we're modeling vulnerability, and we're communicating to our colleagues it's okay to feel this way. And so we, you know, as hospitalists, we have incredible strength, and our colleagues are incredibly strong, and we get to model that all the time. We have an opportunity to model vulnerability for our colleagues as well. And Sarah's right. That act of acknowledging to colleagues that this thing has been hard for me opens a door in a way that it rarely is in terms of interactions with colleagues. We had I was on an incredible call with my team this morning when one of our senior leaders, you know, we were walking through like our PPE backlog, and do we have the supply chain and all this kind of stuff that a lot of places are dealing with. And she stopped and she said, you know what, I just have to tell you guys something. I had a really, really hard day yesterday. I cried 3 times throughout the day and I didn't know why. And she said, I finally figured out by the end of the day why. And she said, it's because I realized that behind PPE, there are human beings, and PPE is a connection to human beings. And she said, you know, in the middle of this meeting, which was not about people connecting emotionally necessarily, she said, has anyone else been experiencing anything like that? And out of the woodworks, you know, with this tiny sliver of opening, out of the woodworks, you know, came a couple other executives talking about their families, some of the other providers talking about what's been going on for them. And it was like a 10-minute diversion from the meeting, but paradoxically was exactly the thing that was needed to get back on track, and to actually do the work and have the energy to do the work that we needed to do around supply chain, et cetera. So just a model of, it never ceases to amaze me how a vulnerable comment can actually open the doors for some really meaningful connection in ways that can be surprising.
Wow, yes, absolutely. Thanks for sharing that story. I mean, there's almost a story like that every time this topic comes up, and anytime somebody's vulnerable. It's very rare that you open up and you're vulnerable and it's radio silence, because I think people have this immediate need to help you not feel alone in that moment too. All right, so the final step is to intervene. So take action to make change or to get help. So to you all out there on the call, if you are struggling right now, you are not alone. I can tell you, I struggled. I'm just now starting to feel better after that intense week that I had in the COVID unit. Find a friend, a peer, or a professional to help you. Here's a couple things that we've kind of put together in terms of what you can do if your colleague is struggling. Obviously, just give them your time. And listen and make eye contact. This is what we learn to do with patients, and it's so important in these more vulnerable conversations. Validate and legitimize their emotions. Let them know, of course, you're feeling that way. This you've had a really, really difficult week, or you experienced something really traumatic. You can ask what's worked for them in the past or what's helped you. Sharing available resources and even offering to accompanying them or getting that resource to them, so that they don't have to do any extra steps if they're depleted. That can be difficult. And then check in and commit to check in with them again. I will add here too that when we have these type of vulnerable conversations, oftentimes more serious things come up. So you may find that you're in a conversation or have been before where somebody says, you know, I really am not okay. I'm not sure, I'm feeling hopeless and helpless. Or I actually was talking to a call or in a small group, and somebody shared that a hospitalist at their organization had committed suicide just the week prior, and I could tell that person wasn't doing okay. So just know that when you open these conversations, there's always this possibility. It shouldn't cause you to be afraid to have these conversations, but in those moments, you don't have to be a trained therapist. You just have to be human, listen, empathize, and then get them the help that they need and follow up with them, and just be empathetic to their situation, or even think for a moment, what would I want somebody to say or do for me if I was having those feelings? And so I hate to share this without also sharing that sometimes those things come up, especially given the gravity of the situation that we're all in right now. Patrick, what would you like to add to this?
Yeah, and the sort of corollary to that is, and it's kind of one of the freeing things about this as a tool, is that, you know, the point is not to solve this for the other person. Obviously, if someone expresses suicidal thoughts or that kind of thing, then connecting them with resources and walking them to where they need to go and that kind of thing, you know, come in. But part of the power of this as a skill, at least in my experience, is that it is an intervention in and of itself. So I think oftentimes we feel like if we go down this path, then all of a sudden I'm going to have all this on my plate that I'm going to be expected to solve. What's remarkable is that the act of checking in, the act of listening, the act of validating emotion, the act of validating experience, in and of itself is an intervention that has a meaningful impact to the other person. So I would just call that out as well, because I think that in my experience, that's been part of the journey for me is that just using the skills is enough a lot of times.
Yeah, absolutely.